My name is Sajid Zafar. I graduated from Dow Medical University in Karachi, and I've been at St. Luke's for the last 18 years now. I'm Chief of Gastroenterology here. So I think my patient care philosophy is that as a physician, I think the most important thing is we need to learn to sympathize with the patient, and that's something which you learn over a period of time. I agree with the philosophy of St. Luke's Hospital, patient first, and that's been my goal also, to take care of the patient and their issues and take care of them with as much kindness as I can. I think the patient will describe me as a doctor who's caring, compassionate, and then I think I always give them the priority, and most of the patient will say I'm easy to work with. I'm a very outdoorsy person. I do golfing, I love gardening and hiking, so if weather is good and if I'm somewhere where this all can happen, you won't find me in the house. One of the reasons I chose St. Luke's as home for myself, and I've been here since I finished my fellowship back in 2001, and I've been here since then, is the strong medical community we have. The medical staff we have, the services we have, the care we provide, it is a phenomenon. People talk about transferring patients to other hospitals and other facilities. We take care of our patients. Our nursing staff, our consultants in different specialty, they are phenomenal, and we provide a great care to the patients. And we are very proud of that. So I think the bulk of our patient comes in for either office visit or to have a procedure done, and these are the patients which we have not seen before. So most of them will include colon cancer screening patients coming in for colonoscopy, where you examine the colon, remove the polyps which can lead to cancer formation, and you take care of them. We do a lot of endoscopy procedures, which is the examination of the esophagus, stomach, and the upper part of the intestine, and take care of issues with acid reflux, trouble swallowing, bleeding, ulcers, cancer, and this kind of stuff. So those are the two main reasons we see patients in the endoscopy lab. In the office, we see patients with a lot of liver disorder. People have a lot of liver issues, different kind of hepatitis. Then there's a condition called colitis, which is Crohn's disease or ulcerative colitis. And there are certain other kinds of colitises. People comes in to see having issues with diarrhea, bleeding, and things like that. At this point, people don't have an excuse not to have colon cancer screening done, because you have more choices than one person did in the past. It can be as simple thing as doing a stool test or doing a colonoscopy. So things which have changed now, that we have this newer test available, which is a stool-based test where they check the DNA for these abnormal tumors or polyps which shed that into the stool, which can be detected. And that's an alternative to having a colonoscopy done, especially for the folks who are relatively old or otherwise sick to undergo a procedure. So for an average risk person, which means that you don't have a family history of colon cancer, you don't have any symptoms, then age 50 is the starting point for your first colonoscopy or colon cancer screening done by stool test. Colitis is basically inflammation of the lining of the colon. Could be because of multiple reasons. One of the commonest causes of colitis we see, or inflammation in the lining of the GI tract, is called Crohn's disease, which can involve from your mouth all the way to the rectum, and ulcerative colitis, which is basically ulceration in the lining of the colon only. We don't know the cause of that, but they can make patient life quite uncomfortable. Part of it is hereditary, but there are certain environmental factors which can predispose a person with a specific genetic predisposition. There is not one factor we can talk about, but there are just a lot of unknown factors which can lead to development of these diseases.